Good evening everyone, and welcome to tonight's webinar on collagen peptides in sports rehab and recovery. We are incredibly fortunate to have a leading expert in the field, Mr. Scott Bergman, with us this evening. Mr. Bergman is a board-certified naturopath and certified functional medicine practitioner based in Walnut Creek, California. Dr. Bergman brings a wealth of knowledge and experience in natural health and wellness, and he's here to share his expertise on the fascinating world of collagen peptides. Attendance will be taken shortly before the Q&A session for those wishing to apply for PTCPD credits. You can either scan the QR code that will be displayed on the presentation slide, or click the link that we will provide in the chat box later. Please ensure that you have your registration number with you. So, let me now hand on the time to Mr. Bergman. Mr. Bergman, please.
Hello, everyone. My name is Dr. Scott Bergman. It is my great honor to be presenting to you today. I thank you very much for taking the time out of your busy schedule. I hopefully have some interesting things to discuss and hopefully things that will help you and your patients recover faster and optimize their health. So let's get started. There are four main types of tissue in the body: muscle tissue, nervous tissue, epithelial tissue, and connective tissue. Collagen, elastin, and ground substance makes up the connective tissue, and we'll be talking mostly about collagen and collagen peptides. Collagen is the longest molecule that has been discovered in the body. If it were as thick as a pencil, it would be 1 yard or almost a meter long. They are stronger than steel. They could hold 10,000 times their own weight. It gives our tissues the tensile strength, resiliency, and structural integrity. It's the most abundant protein found in mammals. It makes up 25 to 35% of our entire protein mass. 90% of our bone is organic collagen. There's also elastin. Elastin is more like rubber bands that bind the collagen fibers. It allows the tissue to stretch. It helps for shock absorption. Fascias, tendon, and ligaments, they all contain collagen and elastin fibers. There's also ground substance that we need to discuss. The ground substance is a viscous, transparent fluid. I almost think about it like the egg white consistency.
Sorry, Dr. Bergman, pardon.
Yeah.
You have to share the screen.
Oh.
Can you do it?
It says send a request.
Okay, it's okay now. It should be okay now.
All right, how about now?
Yeah, it's okay.
I'm very sorry about that. Well, let's go back to the collagen. Longest molecule in the body. If it were as thick as a pencil, it would be 1 yard long. It is stronger than steel. It could hold 10,000 times its own weight. It's the most abundant protein found in mammals. It makes up 25 to 35% of our protein mass. And bone is about 90% organic collagen. Then there's the elastin that gives us our shock absorption. They stretch like rubber bands. And back to our ground substance. The ground substance to me is like the consistency of an egg white. It makes up our extracellular matrix. It is comprised of glycosaminoglycans or GAGs. A GAG is a core protein with a bottle brush chain made up of things like hyaluronic acid. It creates our structural support, resiliency, and elasticity. It is required for cell adhesion so the cells can anchor. It disperses shock. And something important to remember about the ground substance and these glycosaminoglycans is they are highly polar. They have an electrical charge and they attract water. So having healthy collagen, having healthy ground substance allows the body to have a much more fluid-like consistency. That consistency allows our tissues to remain healthy. The ground substance, when it is warmed up with movement and exercise, it becomes a liquid state. However, if there is an injury and the tissues don't move, those tissues can become hard, and that then reduces the body's ability to exchange nutrients and cellular waste. And if the tissues become too hard, it restricts motion, it dries up, and we are bound for injury. The ground substance is in everything. It's the great organizer of the body. When we take ground substance and red blood cells, we get blood. If we take some collagen and elastin and ground substance, it creates the fascia in our tissue. If we take thicker ground substance, more collagen, more elastin, that makes our ligaments, tendons, and when we take the ground substance with collagen and elastin and then embed minerals, we get bone. All of this is from the connective tissue made up of collagen, elastin, and ground substance. And when we go through school, we learn the anatomy as separate tissues. There's the Achilles tendon, there's the patella tendon, there's different ligaments. But what we are finding now is that this tissue is all one. From the top of our head to the bottom of our feet, it is all the same fascia that embeds through the muscle tissue, collects at a point, then we call that a tendon. That tendon point then connects to more fascia. We call that the periosteum, or the wrapping around the bone. That connective tissue continues as bone with embedded minerals, and that cycle continues where it's another tendon, another muscle, another tendon, another periosteum, bone. All of it is connective tissue made up of collagen and elastin and ground substance. Within the collagen fibers, there are mechanoreceptors, receptors that respond to mechanical pressure or distortion. Mechanoreceptors are innervated by sensory neurons, and they convert that mechanical pressure into electrical signals to the nervous system. And what was found is that the fascial network possesses 10 times the sensory receptors compared to its muscle counterparts. Whether it's muscle spindles or Golgi tendon organs or the Ruffini corpuscles for heavy pressure and joint movement or skin stretch, or even the pisciniforms in the synovial fluid, what this implies is that performance, recovery, and injury prevention all has to do more with the health and the well-being of our collagen. If there is an injury or some sort of noxious stimuli, that stimulates pain receptors, or what are called nociceptors. When nociceptors are stimulated, it suppresses mechanoreceptors. That's why when we're in pain, we don't want to move the joint. What we've also found, though, is that if we can get therapeutic movement into the joint and encourage movement, that upregulates the mechanoreceptors. And if the mechanoreceptors are upregulated, the nociceptors, the pain receptors, are reduced. This mechanism of mechanoreceptors is all intimately related and synergistically occurring with the connective tissue, not as much with the muscle. When the cell walls are damaged, that will release NF-kappa B. That produces cytokines for anti-inflammatory and pro-inflammatory chemicals, and that will lead to an acute response necessary for pathogen clearing and tissue repair. But it is important to remember that swelling and inflammation puts pressure on the collagen fibers, which have those receptors. It's the receptors that create the inflammatory response. So the connective tissue is intimately related to not only the inflammatory response, but the repair response. When we talk about therapies for collagen tissue, there has been discoveries of specific collagen peptides. And specific collagen peptides is very different than just collagen. There's a hierarchy of collagen in the nutritional world. There's regular collagen protein that we can find in any supermarket. And that stuff is not bad. But when they put it through a process, they found that they were able to separate the specific collagen strands and then even separate it further into specific collagen peptides. So I equate this, or I make an analogy of a rope. The rope is like a full collagen protein. The strand that you see is like a collagen peptide, where the peptides make up the full protein or the full rope. But the fibers of those strands are those yarn segments. Those are analogous to the specific collagen peptides. And there are several that we're going to talk about now. One of them is for the health and well-being of bone. And we know that bone provides structural support. We know that it also provides protection. It protects the brain. The rib cage and the pelvis will protect vital organs. We know that the bones can be used as levers where tendons and ligaments can attach to for movement. But there are other underappreciated functions directly related to sports performance. Often we only think about the health of the bone with our athletes if it's broken. However, there's several functions that occur within the bone and that help the rest of the body. Bone is a mineral storage facility for the entire body. Bone has a mineral makeup where 39% of bone is calcium, 17% is phosphorus. The rest are other trace minerals like magnesium and zinc and potassium. 99% of the body's calcium is stored in the bone. However, we need to remember that muscle contraction and relaxation requires calcium. If we're not getting our calcium through our diet, the muscle still needs to contract. And remember that our heart is a muscle. We need the heart to keep beating. If there is a depletion in the storage of calcium in our tissues, the body will start to break down bone to release calcium to keep us alive. Calcium is also needed for nerve impulses. Calcium also releases neurotransmitters like GABA and glutamate and serotonin and dopamine and adrenaline. Calcium is needed for blood clotting, hormone secretion, and cell division. Phosphorus is also a plentiful mineral in the bone. It's required for the hydroxyapatite bone mineral matrix for the hardening of the bone. But we also use phosphorus for energy production. It's a component of ATP, adenosine triphosphate. So without enough phosphorus, we're not able to produce enough ATP in our muscles. If we don't have enough phosphorus in our bloodstream or in our tissues, the bone will break down to release phosphorus so that we can continue making energy. So bone is necessary for all aspects of muscle protein synthesis and energy production. It's also required for pH balance. When we are looking at high endurance and we're looking at lactic acid buildup, there's a pH balance that needs to occur. If we don't have the minerals in our bloodstream, we will pull those from our bone. Phosphorus also helps with DNA and RNA synthesis and enzyme reaction. There's immune functions that happen with our bone through the red bone marrow that makes pro-inflammatory and anti-inflammatory cytokines for tissue repair and recovery. There's yellow marrow that helps as a source of fuel for the bone, and the bone will even act as a detoxification organ to protect other organs. It'll pull heavy metals into the bone. The bone makes several endocrine chemicals for bone mineralization. It's also responsible for insulin secretion, glucose metabolism. So without healthy bone, we can't utilize sugars properly. There's fibroblast growth factors that occur from the bone. There's appetite and energy metabolism regulation that happens from the bone. Red blood cells, white blood cells, and oxygen transport happens by the bone stimulating hematopoiesis. And there's even sources of calcium needed for the parathyroid hormone for gut motility, digestion, and vitamin D absorption. Remembering that bone are mineral crystals in an organic collagen matrix, so collagen is essential for the bone flexibility and elasticity. And as we deplete minerals, we will deteriorate the collagen in our bone, and that's how we get osteoporosis. Peak bone mass is a measurement of bone density. We reach a peak of bone density in our mid to late 20s. It helps reduce risk of fracture, and it determines the incidence of osteoporosis. So it's important to understand that peak bone mass determines osteoporosis, which means that osteoporosis is determined in our late teens or early 20s. If we have, let's say, female athletes that have slightly less bone density and they are overtraining and their body needs more calcium, the bone will release calcium because the demands of the body and the muscles utilization is greater than the supply. The bone will release the calcium so that the muscles function properly but that's how we get the deterioration of the bone and the osteoporosis. And as the bone becomes more porous, it also degrades the collagen. So the collagen peptides for bone promotes healthy osteoclastic activity. It counteracts collagen degradation. It supports the flexibility and the elasticity and mobility. You can see how the collagen fibers run in several different directions in bone, which is embedded then by those minerals. Receptor density is increased with improved collagen, and that helps with cell signaling. The collagen peptides will improve bone mineralization and bone density. Here was a study with 180 women of postmenopausal age with osteoporosis or osteopenia. And after 12 months of ingesting 5 grams of a patented form of collagen peptide called Fortibone or a placebo, the results indicated that the collagen peptides created an anabolic effect, increased bone mineral density, decreased the catabolic activity. The placebo group got worse, their bone mineral density reduced, and all of this was confirmed by DEXA scan. I think it's important to remember then for our athletes that we have to look beyond the muscles, the ligaments, and the tendons and cartilage. We need to think of bone as a major organ for sports performance. For joint protection, we need our collagen to be healthy, and that requires a lot of collagen. There are specific collagen peptides for cartilage growth. There's a patented form of collagen peptides called Fortigel. There was a study in 2007 showing that oral administration of a specific collagen peptide, this Fortigel, was successfully able to absorb into the intestines and stored in collagen. This caused an increase in cartilage tissue metabolism, and it stimulated regeneration of healthy cartilage tissue. And you could see on the right cartilage tissue without the Fortigel and cartilage tissue with the Fortigel. Another study at Penn State University in the US, a 24-week randomized double-blind placebo-controlled study of 147 athletes, 72 male, 75 female, average age around 20. A physician examined their joints for mobility, inflammation, and pain. The athletes were asked to fill out a visual analog scale for pain, and the parameters were pain at rest, standing, walking, lifting, and carrying. The pain perception significantly improved in the treatment group. Fortigel outperformed the control group when the control group used other therapies like hydrotherapy, massage, and ice. There was an additional subgroup of 63 subjects with knee pain. All parameters were improved using Fortigel, as well as the reduced pain at rest, walking, standing, also running, and running while changing directions. At Tufts University and Harvard University, there was a very long-term study of 48 weeks. Group 1 got 10 grams of Fortigel a day. Group 2 was the placebo. And they confirmed the findings using a very specific type of MRI. You can see the placebo group at top, they tested at day 1, at 24 weeks, and 48 weeks. The degeneration of the placebo group got worse, And if you could see those red specks, that is a sign of inflammation. It was showing that there was more chronic inflammation in the joint. Conversely, after 48 weeks with Fortigel, you could see that the cartilage at 48 weeks got thicker, and those green specks show that the inflammation was no longer there. At the University of Freiburg, they did a 12-week study with a randomized double-blind controls with 160 subjects. Group 1 got 5 grams of Fortigel. The placebo group got, I believe it was maltodextrin. After 6 weeks, there was improved pain and stiffness and improved function. But after 12 weeks, there was even more gains. 70% of the treatment group with Fortigel had positive results. 40% reported no pain at all after the 12 weeks. Another 12-week study showing, again, 5 grams of Fortigel. They were examined by physicians before and after. The placebo group got to use alternative therapies like ointments and other physiotherapies like ice. However, the specific collagen peptide group had a significant reduction in pain, and that was consistent with the physician's evaluation. Another type of specific collagen peptide for tendons and ligaments is Tendofort. The healthy tendons and ligaments are required, obviously, for flexibility and mobility of the joints. Physical activity of individuals are especially at risk for injuries related to overuse and dehydration and breakdown of tissue. A clinical study done in 2001 where they did an oral ingestion of Tendofort, a specific collagen peptide, after it was tested at 0, then at 6 weeks, and then at 12 weeks. There was an increased firmness in the tendons and ligaments, but also an increased elasticity. There was an increased resiliency and pliability and decreased deformation. So when the ligaments and tendons were stretched, the tissue came back to its original form. And with the elasticity, they measured the speed of how fast the tendons would contract and how they would relax, all improved using the Tendofort. There was another study done with the specific collagen peptides for reducing injury and rupture. When there is an injury, there's changes to the extracellular matrix, and that can reduce the tissue's ability to extend, diminish energy absorption, and there's often tendinopathy or ruptures. There was a study done with human tissue of tendons and ligaments, and when it was exposed to the specific collagen peptides of Tendofort, it produced 1.2 to 2.4 increase in cellular tissue matrix. There was also an increase in RNA expression of collagen, and there was a 50% increase in the synthesis of elastin, which is the prominent component of the ligament matrix. There was a reduction in tissue degradation and breakdown, and that was because of the downregulation of the metalloproteinase, which breaks down collagen. So there was an increase in anabolic activity in this test, and there was a decrease in catabolic activity. There was a study done with Achilles pain and tendinopathy patients. Microvascularity has been connected to poor healing, pain, and swelling. There was a 6-month trial of specific collagen peptides Tenderfort. Measurements were made through enhanced ultrasound. After the 6 months, there was reduced microvascularity, accelerated tendon tissue repair, and accelerated recovery time. And the Australian Institute of Sports stated that this would also optimize athletic performance and workouts. They showed that the specific collagen peptides improved recovery rates of athletes. One of the things to look out for with our athletes is chronic ankle instability. There was a 6-month study of 50 male and female athletes with chronic ankle instability. The therapy group got 5 grams of Tenderfort, the specific collagen peptides, every day. The placebo group got multidextrin. The results were that there was significant improvement in ankle stability, but more important, after a 3-month follow-up, there was a significant decline in the number of re-injuries, which often happens with instability. Skin is another organ that should be considered with athletic performance. We know that our skin has a protective barrier. We discussed the mechanoreceptors for touch, temperature, pain, and pressure. There's temperature regulation when we sweat. We excrete toxins through the sweat, but we also excrete electrolytes and water, which will dehydrate us. Our skin will also absorb, and as we know, the skin is necessary for proper vitamin D synthesis for bone health and for immune function. Clinical studies have shown that specific collagen peptides builds healthy skin, but more importantly, it promotes dermal collagen and the extracellular matrix. And we'll talk a little bit more about the extracellular matrix in just a moment. The verisol, the specific collagen proteins, support the elasticity and the hydration of the skin. Studies show that the hydration and elasticity was increased by 15% compared to a placebo. Sustained use of the specific collagen peptides continued even after 12 weeks of use, so the improvements continued. There was decreased cracking or chipping in the nails by 42% after 6 months of use. If our athletes are getting peeling or cracking nails, let's consider that is a collagen deficiency. Obviously, it could always be something with our thyroid, but let's consider that that's an issue, a sign that we are losing collagen in our tissues from overtraining. There was another 4-week study showing an increase in pro-collagen concentration by 60%. Cellulite is that lumpy, dimpled flesh, but it's caused by fat deposits pushing through connective tissue. If fat deposit is pushing through our connective tissue is breaking down. There is a condition to the connective tissue. And when the connective tissue gets stressed, then the collagen fibers become inflamed and then often create adhesions, and that's what creates the dimpling. So when you see an athlete who's pretty lean, but they have that dimpling, this is a collagen issue. The reason why I think collagen peptides for the skin is so important is because it's been discovered a possible new organ, and that organ is called the interstitium. It is a contiguous connective tissue and fluid-filled spaces throughout every tissue, every organ, and every system in the body. And it is comprised specifically of collagen and the ground substance. If you see here, we've got two cells, and just that very, very small space in between the cells, there is these collagen fibers and ground substance and fluid-filled spaces. And chemicals will pass through and dump into the capillary of the lymphatic system. So our entire immune system is dictated by the health and well-being of this new found organ, the interstitium, that is made up completely of collagen. And these collagen fibers within the interstitium have what they call mechanosensing and mechanotransduction. And I think about it like a spider web. When an insect gets caught in a spider web, because of the vibrations caused by the movement of that spider, those vibrations are received by the spider, and the spider understands very quickly exactly where on the web that insect is caught. It even knows the size of the insect, and it knows what kind of insect it is, all because of the messages going through the vibrations going through the spider web. The collagen fibers are exactly the same. The collagen fibers are like those cobwebs. So as chemicals are moving, or as our body is moving, the collagen fibers sense the movement, the mechanosensing, the detection of the tension and the compression and the shear, and then the integrins, ion channels, and the G proteins transmit the mechanical signals into the cells. Those mechanical signals then get converted to chemical expressions. It's the collagen that sends messages for gene expression, protein synthesis like muscle protein, cellular proliferation, differentiation, and migration. The interstitium will also communicate inside the cells through the extracellular matrix, creates an immune cell activity. It is the collagen proteins that stimulate stem cell production within the interstitium. It's the collagen proteins that hit those receptors on the cell for hematopoiesis, so stem cells for red blood cells, white blood cells, and it is found to even be an endothelial progenitor cell, again, a different type of stem cell for blood vessels. All of this is because of the mechanical receptors of the collagen. With athletic performance or exercise recovery or sports injuries, we have to be able to allow the body to proliferate and build tissue, but there also has to be a cleansing. We want to make sure that things grow, but not grow out of proportion. We want to be able to prune the tissues to keep them clean, but we don't want to prune too much so that there's no leaves on the trees at all. This is two slides. On the left is muscle tissue. On the right is what happens to muscle tissue after normal, moderate exercise. there is a breaking down of the tissue. Just like if we were wanting to build a beautiful building, there's a job site, and every day as the building is being built, there's debris that occurs. And at the end of the day, all the workers are supposed to clean up the debris. The reason is if you don't clean the debris, after 2 days, you have 2 days of debris, or 3 days of debris, or 4 days of debris. And that's when accidents and injury happens. I see this as the same thing for our body, where if we don't have the ability to clean up the debris, that creates an inflammatory response where the body is then prone to injury. Here we have solutions for you where we can use specific collagen peptides, a specific collagen peptide for bone regeneration, specific collagen peptides to repair and regenerate cartilage, collagen peptides for healthy tendons and ligaments, and Verisol for not only skin and hair and nails, but I will present to you that this is what keeps the interstitium healthy for proper gene expression. Thank you for your time. If there are any questions, I'd be happy to take them. Everyone, I want you to be able to also see that there's a QR code. If you want to scan that, that will allow you to prove your attendance. And I'll give you a second, but is there any questions that I can help with? As we're wrapping up, I'll just let you know that we have the specific product with all four of those specific collagen peptides. I've been in practice for 30 years. I treat an enormous amount of age group athletes, high school, college athletes, and pro athletes. We've had great success using these specific collagen peptides. I hope you take the opportunity to use them, but also remember that these collagen peptides, you need to allow several weeks. I would recommend that you use these collagen peptides with your athletes before they get hurt and use it as a preventative. Getting it in for on a daily basis, 1 scoop, possibly even 2 scoops a day, can help prevent damage. So here's a question. Is the recommendation sport specific? Would it be different for marathon, tennis players, or swimmers? It is not different. I would recommend, unless it's an acute injury, I would maybe use 2 scoops a day for about a month, and then keep them on this 1 scoop a day. Can it describe more about collagen 1 and type collagen 2? Yeah, the collagen type 1 and type 2 proteins are very important, but those are the whole protein. Whereas when you're using a specific collagen peptide, you're using the bioactive aspect of that molecule. So it's much more concentrated than the entire protein. Type 1, type 2, type 3, that's all skin, hair, and nails. Also, I just want to reiterate that the interstitium is type 1 and 3 as well. Someone says, thank you, you're welcome. What if you're already prescribing glucosamine to the patient? That's perfectly fine. They don't counteract each other. In fact, they would more than likely enhance, but you don't need the glucosamine because of the specific peptides themselves. Can you find specific collagen peptides in food? You could only find the whole protein. So that means it's much less concentrated. You have to eat much more collagen type foods to get those specific peptides. So we're talking about very, very specific molecules within the entire peptide chain. Yeah, you could take, and then Li Ling Ling asked, but can you take glucosamine with the collagen peptides? Absolutely. What's I would say even more important is hydration, making sure that your athletes or any of your patients are getting at least half their body weight in fluid ounces of water and a proper electrolyte formula as well, because it's the electrolytes needed within the collagen and connective tissue, those gags, the ground substance, to keep the tissue polar, which keeps it resilient. So I would even say the specific collagen peptides with an electrolyte formula is more important. Those are the questions that I see right now. I believe that might be it. Are there any other questions? Anything that I can help with? If anyone is thinking about a question, we've used this very successfully with patients with osteopenia and osteoporosis. It takes a full year, and we definitively use other supplements, but we are able to confirm this with DEXA scan and a blood test called N-teleopeptide. And that's a blood test to show osteoblastic activity. And we've been able to confirm that with several patients with osteoporosis using these specific collagen peptides. For strength athletes, I would definitely put them on this. And I would, Wang Wing Kin asked about the difference between marathon runners, tennis players, or swimmers. Your endurance athletes break down collagen much faster, I think, than the strength athletes. But someone who plays tennis or golf or any type of explosive movement where it's a dynamic explosive movement like a tennis swing or a baseball swing, you want to make sure that it's not just the tendons and ligaments, but it's all of the fascial sheaths around the muscles that stabilize the muscles through its contraction. So the stronger your connective tissue is, the better your collagen is, the more power you're going to produce in that muscle contraction. Are there adverse effects for taking specific collagen protein? We have found absolutely none. It's just a form, it's a very, very concentrated form of collagen protein with no poor effects. You might even find as a positive effect that digestion improves because collagen is hydrophilic. It loves water, so when it's in the intestines, it'll absorb a little bit of water, and that will help with gut health as well. Are there any patients or clients that you're thinking about that you wonder whether this would be a positive therapy for them? Any age is appropriate. Young children, once athletes get into high school, they're really breaking their bodies down, and there tends to be a little less of a proper diet. Li Ling Ling, many patients are taking supplements like calcium, glucosamine, and vitamin D. That's all appropriate. That would only enhance the body. If they take special collagen peptides, do they need to take those? Li Ling Ling. When you say those, are we talking about the specific ones that I talked about? Uh, those are patented bioactive specific collagen peptides. So again, I wanted to show you that hierarchy. There is a difference between regular collagen protein, collagen peptides. You can find that in any health food store. But in order for something to be a bioactive collagen peptide, you need to prove that through double-blind, placebo-controlled studies. The Fortigel, the Fortibone, the Verisol, and the Tendafort, those all have scientific backing. And if you saw the years of those studies, they're as old as 2000. So these products are very, very specific, and we haven't seen any others that do this. What is the minimum time frame to see an improvement? Great question. You'll start to see improvement anywhere from 3 to 4 weeks, but the studies have all been on 6 or 12 weeks. Some of them were even 24 or 48 weeks with severe knee arthropathy. So the worse the condition is, like a degenerated knee, we've done this in our office where we've told people you could get surgery or we can do therapies and you could have these specific peptides, but you have to give it several months. And if you think about how long surgery takes, where they have the surgery, they have to recover from the surgery, then there's therapy throughout the surgery, then they have to get back to training, and then they have to get back to actual competition level. That takes several months. So we've been very successful with like the Fortigel specifically for knee cartilage, but it does take a couple months. Can you take them in combination and at the same time? Well, actually, I use these four specifically are in one particular product. All four of those specific collagen peptides are in one canister. And in that one canister, there's 5 grams of the Fortibone, the Fortigel, the Tendofort, and 2.5 grams of the Verisol. So yeah, it all comes in one. And it's flavorless. It can go into any drink, any electrolyte drink, any protein drink. You could put it in anything. These are all good questions. If you have the ability, I'd love for someone to type in an example of who they may think this is for. What clients do you think you could use this on? As we're wrapping up, we have just a couple minutes. One thing I want to present to you is hopefully this information has been useful. You now have information that can help people with pain, help people with injury recovery, and help people with performance. All of your patients and all of your clients respect you, and they look to you for answers. I hope that you will consider using these specific collagen peptides for your patients. They're counting on you to provide them with information that can provide pain relief and performance. I wish everyone luck, and I hope you take advantage of what may be available to you. Are there any other thoughts? You do not need a prescription. However, this is what we consider a nutraceutical, meaning it is pharmaceutical grade nutrition, and you need to get that from specific healthcare providers. Healthcare and Co., which is owned by Humana Medical, who is sponsoring this, they have access to these specific collagen peptides. I'm being thanked for my presentation. You're very welcome. It has been my honor.
Thank you, Dr. Bremen.
You're welcome.
Thank you.
All right, we're all set.
Yes, okay.
All right, I'm going to sign off then. Yes.
Sure, then I will.
All right. Thank you very much. I hope that was helpful.